Cultural Aspects of Anesthesia, Jehovah's Witness, by Paul Marconi and Nicole Olson. In this presentation, we will appreciate the religious beliefs of Jehovah's Witness patients, gain an appreciation of blood utilization in the Jehovah's Witness patient, examine a case study, explore the implications to anesthesia, and review current evidence in caring for Jehovah's Witness patients. Jehovah's Witnesses have a website, jw.org, that is organized intuitively and has a great frequently asked questions section to further understand the religion. The background. Jehovah's Witnesses are a Christian denomination founded in the 1870s. Jehovah's Witnesses' abstinence from blood products has its foundation in the Bible. The specific verses are listed on this slide: Genesis, Leviticus, Deuteronomy, and Acts. The actions of abstaining from blood is done in the obedience and respect to God as the giver of life. The use of blood products in the Jehovah's Witness patient is multifaceted. For each Jehovah's Witness, religion and personal choice lead them to accepting different treatments. This slide will review the general information around blood and blood product acceptance. Generally not accepted blood products are red blood cells, platelets, white blood cells, plasma, or whole blood. Autologous transfusion or receiving your own banked blood is not accepted because the blood has left the closed loop of circulation. Generally accepted practices are EPO injections to stimulate red blood cell production and artificial oxygen carriers. Individual choice plays a large role in other blood products and techniques. Some of these are albumin, clotting factor, and methods continuous with the circulatory system like hemodialysis and cardiopulmonary bypass. Here is a deeper look into blood products and techniques. Before discussing these categories, it must be said that the most important aspect in caring for Jehovah's Witness patients is to ask them their preferences regarding these practices. We will address this later on as well. As every operation has different risks of bleeding, not all of these blood products and techniques will need to be reviewed with the patient. Products and techniques more commonly used in anesthesia that we should be aware of are EPO possibly containing albumin, whether or not the patient will accept coagulation factors, tranexamic acid, desmopressin, and their view of blood salvage techniques. The pearls of bloodless medicine techniques. The patient's right to autonomy must be honored above all else. Providers may need to set aside their belief in what is right for the patient. The patient should receive the benefits and risks of each option. A preoperative screening process should be in place to identify these individuals. A checklist for blood products and techniques should be used on each patient to guarantee their wishes are carried out. It is also important to review the options with the patient and ensure the patient is free of coercion by the provider and religious leaders. And when possible, optimize the patient preoperatively. The figure on the right shows an algorithm to use when assessing a Jehovah's Witness. In these patients, a CBC should be evaluated because generally blood products cannot be given if an emergent situation arises.
Okay, so now that we know a little bit more about Jehovah's Witnesses and their background, we're going to dive into our case report. So our case report involved a 35-year-old female presented to the hospital at 32 weeks gestation with total placenta previa. The MRI showed total placenta previa that covered the internal cervical os and also suggested placenta accreta because of the undefined boundary of the placenta and retroplacenta myometrium. And you can see that here in the image to the right. She had refused autologous and allogenic blood transfusions. However, she had agreed to acute normal volemic hemodilution, blood salvaging, and biological products. This would be things such as fibrinogen and albumin. The cesarean section was scheduled at 36 weeks, and preoperatively the patient underwent insertion of bilateral common iliac artery catheters, which were to be used after fetal delivery. She had received an iron injection to bring her hemoglobin up from 9.4 to 12. When the elective surgery was to be performed, the patient was moved from IR after the catheter insertion to the operating room. This is when anesthesia's role stepped in. The anesthesia team administered intraoperative transfusions of acute normal volemic hemodilution and performed intraoperative blood salvaging. During the surgery, 400 mL of blood was removed from the mother through a closed circuit, and the patient was then given LR, albumin, and hydroxyethyl starch as a replacement for a hemoglobin goal of 8. The time span between induction of general anesthesia to fetal delivery took approximately 4 minutes. After delivery, the iliac catheters were then inflated and oxytocin was administered to decrease bleeding. The balloon stayed inflated for approximately 9 minutes, and a Bakri balloon catheter was inserted into the uterine cavity after the iliac balloons were then deflated. Maternal blood was returned to the patient, totaling a loss of almost 2 liters. The patient was stable with an unremarkable post-op course. Iron supplementation was given for days after delivery to increase the post-op hemoglobin of 6.7. The patient and the baby were both discharged home after the 16th day post-op. This case demonstrates the multidisciplinary team that is needed to respect and care for patients with specific cultural beliefs. We will further discuss the various treatment options for this patient and anesthesia's role in caring for this type of patient population. Alright, let's talk about the anesthetic implications of Jehovah's Witnesses in general and also pertaining to this case report. So first, a thorough preoperative evaluation with clear consent to medical treatments and patient preferences on the management of their own case was done in order to provide a successful surgery. Having a multidisciplinary team and strong communication between members shows an increase in positive outcomes. Preoperative labs are needed in order to have an idea of the patient's baseline. These labs could be items such as a CBC or coagulation studies. These are used to obtain goals set forth prior to surgery. Consent for surgery and blood alternatives is done on a patient-to-patient basis and can be very individualized. However, it is important for the anesthesia provider to have those conversations with the patients in order to understand their beliefs and how to best take care of the patient. Intraoperative techniques can vary depending on the patient and the surgery. Techniques in recent literature include a preoperative donation of patients' own blood to be stored and then used when they are scheduled for surgery. Blood salvaging also can be used. This is when blood is removed from the surgical field, it is collected, filtered, and washed, and then is returned to the patient. This may be acceptable to some Jehovah's Witnesses if the circuit is continuous, and you can see that here pictured on the right, this continuous circuit of removing blood and then returning it to the patient. Acute normal volemic hemodilution is an additional technique that is often used with cell salvaging. This involves the dilution of hemoglobin in the patient's body, and then finally, processed products such as albumin, EPO, and cryoprecipitate are also based on individual preference, and these can be given intraop as well. The CRNA must take into consideration the patient and take the extra time to develop a modified anesthetic plan. We will talk about some of these techniques in the upcoming slides with current evidence. Alright, let's take a deeper dive into the current evidence of taking care of a Jehovah's Witness patient. So when taking care of a patient population with specific beliefs and culture, it is the responsibility of the CRNA and other team members to provide the standard of care while respecting the autonomy of the patient. In recent literature, it has been demonstrated that even the most dire situations, such as obstetric hemorrhage, trauma, or neurological emergencies, it is the duty of the provider to maintain a just and fair treatment course, allowing the patient to make an informed decision about their own care. This presents a moral dilemma for the provider, such as in a trauma patient, knowing blood products could save a patient's life. However, acknowledgement of the patient's beliefs, providers are unable to provide a typical treatment plan. Currently, if the patient is incapacitated or unable to make an informed decision about their care, Jehovah's Witness patients carry a card on them stating their wishes for care if they were unable to speak for themselves. However, in situations where a card or a record could not be located, the providers are looking towards the family for guidance. The CRNA must understand the possible wishes of a Jehovah's Witness patient and be able to deduce the implications for not respecting those decisions when they are providing care, even when different approaches to care can be life-saving. The CRNAs have a moral obligation to do no harm. The Association of Anesthetists have come out with current guidelines on how to approach clinical situations involving Jehovah's Witness patients when there is now a greater advancement in bloodless surgery and alternatives to care. A current recommendation would include the patient that has capacity to have the right to refuse treatment or provide consent for specific treatment. Preoperatively, the patient consent is vital to providing appropriate care and to avoid legal consequences if consent is breached. A thorough preoperative consent should be performed in which explains the risks and benefits to refusing blood products along with other techniques that could be used. The provider should be careful not to sway the judgment of the patient if viewpoints differ regarding life-saving treatments such as whole blood. Patients should be told of operations that minimize blood loss for elective surgeries and alternatives to blood products that the patient may consent to receiving. Implementing a safety checklist prior to surgery and induction of anesthesia, such as a second timeout, would be appropriate for care in this population. The checklist would include what the patient has consent to receiving, and this would confirm that all providers have been made aware of the answers to the consent form. Additionally, preoperative optimization of hemoglobin levels prior to elective surgery is recommended. The hemoglobin of 13 and additional coagulation factors should be assessed at least 6 weeks prior to elective surgery. Providers should consider discontinuing anticoagulants, prescribing oral iron supplementation, and possibly the use of EPO, depending on the hemoglobin in the preoperative labs. Preoperative planning is vital for this care in the population. Here's an example of what a consent form for blood products specific to the Jehovah's Witness population would look like. The patient must decide on the types of products that are acceptable or not based on their own beliefs. All CRNAs should be made aware of the patient's consent form before providing care. This consent form should be made in private as to not feel any pressure from family or church members, and documentation in the medical record should have all the patient preferences clearly stated. As we touched on earlier, there's a growing space for alternatives to care when providing for Jehovah's Witness patients. Acute normal volemic hemodilution is a technique that was used in the case study we discussed, along with evidence here shown in 13 liver transplantations for Jehovah's Witnesses. Patients received acute normal volemic hemodilution, which includes removing whole blood from the patient prior to induction of anesthesia. The blood remains in a closed circuit as to not have been disturbed by outside contaminants, making as though it did not leave the patient's body. The removed blood is then replaced with crystalloid or colloid. During the procedure, there is the same amount of blood volume with just a lower count of red blood cells. The lower hematocrit reduces oxygen requirements for the patient along with the anesthesia that is given. The blood is then given back to the patient as an autotransfusion. This can be used as the only blood-saving technique or can be combined with other techniques depending on the patient's consent and presentation.
Summary. There are 2.5 million Jehovah's Witnesses in the United States. They have strict beliefs regarding blood products and techniques. Preoperative optimization and the use of an admission checklist should be performed. Providers must be aware of each individual patient's beliefs and implications to their care. The patient should be educated on the benefits and risks of each option. It is essential for providers to be knowledgeable in care alternatives and be able to provide equitable and safe care for all patients. These are the references used for this presentation.